Good afternoon. I would like to welcome everyone to our June 3rd virtual town hall. This is an ongoing town hall discussion in relation to COVID-19. We are still dealing with this global pandemic that hit our community, hit the world, hit the country some time ago. However, we want to continue to update our residents appropriately with up-to-date, accurate information as to how we arrive at some of the decisions we have arrived at. We continue to have subject matter experts as part of this panel that have been trained to respond to these sorts of events. And so we're very proud of the team that continues to drive some safe solutions for our residents to continue to enjoy their quality of life here in our community. Thank you for our residents who continue to submit some important questions. I find that our residents have found a lot of value in hearing not only the responses, but follow up to those each week. And you can see it's a progression. So I will introduce our panel that is with us here in our City Hall today, and those that are remotely calling in. And then we will open it up for opening comments, as we always do. And then we will follow that with the questions that were submitted and ask for any closing statements as well. So first, I would like to introduce, as always, Bob Snyder, our health officer for the Health Department of Flagler County. Always a pleasure to sit side by side with you, and thank you for your continued leadership.
Oh, thank you for having us, Mayor. Appreciate it. Thank you.
Absolutely. We have our city manager, Matt Morton, who has been the executive arm of this response team as far as city services and ensuring very little disruption that has occurred within city services, and working with our response team. Today we have with us Captain Esconi, who's been an extraordinary leader in responding to this pandemic, is trained in this arena, so has a vast amount of experience and has done an extraordinary job with different stakeholders. Speaking of stakeholders on the call, we have with us our Emergency Management Director for Flagler County, Jonathan Lord. Jonathan has really, I don't think, slept much in the last several months, but has been working day and night, not only in response to that, has had to also watch and mitigate some drought conditions where wildfire danger was at risk and had appeared on a couple instances in recent weeks, as well as we are approaching hurricane season. And so coupled with a lot of that, our emergency management team has continued to meet every single morning in preparation of all of these events that have hit our community or could hit our community in an effort to keep our residents safe, updated, and be able to be prepared. And so we feel that is really important. And last but not least, we have Dr. Stephen Bickle, who is our medical director for the Health Department of Flagler County. Dr. Bickle has brought about a lot of international knowledge and understanding of this pandemic. He has connections all over the world in which he has engaged to bring us accurate information. And this has been a fluid virus. You know, things have changed as we've moved forward. Different information has come about that has helped us make decisions on the best interest of our community. So we'll talk a little bit about that today, of how masks have played a role from month to month and how the decisions have shifted from month to month. And I know Dr. Bickle has a lot to offer in that regard as well. And so thank you so much for the callers on the phone today. Again, thank you for the residents for asking the questions. I will now turn it over to Bob for the Health Department update.
Thank you, Mayor. Everyone, good afternoon, Palm Coast. The three priorities of the Department of Health Flagler and the 66 other health departments still remains the same. Number one, diagnostic testing to identify persons with the infection and quarantine them for 14 days. Number two, contact tracing, which is conducted by our public health nurses and disease investigators to locate, interview, and guide the close contacts of persons testing positive. And third, our special focus on nursing homes and long-term care facilities. So let's talk about testing. Testing is going very well. The goal was to test 2% of the Flagler County population by the end of May, and another 2% by the end of June. So far, lab results have been received on 4,994 Flagler County residents, surpassing the target already of 4% of our community. Drive-up testing is still occurring at the Daytona State College Palm Coast campus site, and testing still occurs at the Department of Health daily. And other testing locations include the hospital and our urgent care centers. Contact tracing, positive case investigations, monitoring and interviewing of close contacts by our epidemiology staff is going really well. As of yesterday, 100% of these activities have been completed and well documented. The goal is to interview all positive cases within 24 hours and identify others at risk immediately. Nursing homes and long-term care facilities have truly been our priority since the beginning of this public health crisis. We have a total of 72 congregate care facilities in Flagler that include 2 nursing homes, several large and small assisted living facilities, and 59 small adult homes or group homes for the developmentally disabled, and Project Warm. All 72 residential homes underwent on-site face-to-face assessments by nurse infection prevention specialists. And as of last Friday, all residents and staff in residential care settings have been tested. 1,550 folks were tested using the nasal swab technique, and so far for the residents and staff working in our nursing homes and long-term care facilities, we've received test results on 500 people, and they've all been tested negative, every single one of them. This was a real essential activity because the 2 most vulnerable groups reside in these long-term care facilities. Healthcare workers and elderly with underlying chronic conditions. So we applaud the nurses and the staff in these settings for adhering to best practice infection control and surveillance procedures. So some of the following indicators that we're tracking, actually the White House is tracking and Governor DeSantis and his team is tracking along with the Surgeon General. These are the gateway to opening criteria. And Dr. Bickle and I, we review these daily. And the first one is, so what is the 14-day positive rate for new cases in Flagler County? Well, it is 1%, which is one of the lowest in the state. We review other indicators as well. Total number of positive cases, 191 at the moment. I mentioned the total number of tests, which is 4.6% of our population. Total number of deaths have remained at 4 for the last 2 months.
Town hall right now until 1 o'clock.
Number of nursing home and long-term care facility cases are 0, so we have 0 residents of long-term care facilities or nursing homes that tested positive for COVID. We have 2 staff members that have, and they're in quarantine and have since recovered. Number of emergency room visits for flu-like or COVID-like symptoms, and that's on a downward trend. And the number of COVID-related hospital admissions, which right now is 1. So the reason why these results, everyone, are trending so well for Flagler County is due to you, Palm Coast residents, for adhering to practices to reduce the spread of transmission, such as social distancing, teleworking, telehealth services, good hand hygiene, careful and thoughtful reopening of the local economy and our businesses, and yes, wearing facial coverings to protect others, including those whom we love and care about the most, our children, parents, grandparents, neighbors, and friends, especially when we are out and about indoors. This is an inexpensive, effective, non-intrusive, small sacrifice for us to make until a vaccine is available. The research, the evidence, and just common sense shows that facial coverings worn properly is a life-saving act to keep the rest of us safe and healthy.
Thank you so much for that update. We're going to go now on the phone to Jonathan Lord to provide an update on your emergency management department throughout the county.
Right. Thank you, Mayor, and I appreciate you allowing me to be part of this. So on the COVID-19 side of things, the county continues to operate the testing site out at Daytona State College with support from the City of Palm Coast, many county departments, the Florida Department of Health, and Advent Health, and Daytona State College themselves. So, and a whole host of volunteers organized through Flagler Volunteer Services. So we have a great team out there. They continue to do testing on Tuesdays, Wednesdays, and Thursdays. And if anyone is looking to sign up and get that testing done, they can call to make an appointment at 313-4200. That's 386-313-4200. And we will schedule you for a testing appointment on a Tuesday, Wednesday, or a Thursday. And we encourage anybody that has had any of the symptoms of COVID-19, which are very similar to common cold and flu symptoms, or if you know that you've been directly exposed to somebody that has tested positive for COVID-19, please give us a call and we will schedule you an appointment. We intend to keep doing that for the foreseeable future until we see the community's demand for that reduced. And then if we do see that demand drop significantly, then our expectation is we will just, we'll probably slowly close down that site and let the health department clinic continue with ongoing testing out in their Bunnell location. To date, we have tested at that site over 220 people. And as recently as yesterday, we tested 93 people. So it's going well, the demand is still good, and we won't be changing anything out there anytime soon. On the other front, as the mayor mentioned, we entered hurricane season on Monday. And even though before hurricane season even started, we had the first two storms in the Atlantic Basin that did not directly impact us. And we did have some tide impacts from Bertha as it passed by our area. And then yesterday, Cristobal developed near the Yucatan in the Gulf of Mexico. And that is actually heading towards, on a path kind of towards New Orleans as we're looking now. And we may see some indirect rain impacts due to that system as it's making landfall along the Gulf Coast of the US, because the east side of that storm is very wet. And so we may see some increased rain chances due to that towards the weekend. But at this point in time, it's not a direct impact to us, not anything to worry about. So we are 3 days into the season, already have 3 storm names used up. But they are great indicators and great reminders to everybody that hurricane season is here. It is a part of life living in our wonderful community here. And we really want people to respect and understand hurricanes and not fear them. And the way that we ask people to respect them is to understand what that impact is to you and your household, and understand if your home is in one of the evacuation zones. And if you are in one of those evacuation zones, then make sure you pay attention to us. And if your zone is told to evacuate, that you do immediately evacuate upon that notification. We don't call all the zones at the same time, and we may only call one zone, or we may call 3 zones or 5 zones. So just pay attention. And if you're not in one of those zones ordered to evacuate, then you may shelter in place, which means hunker down at home while the storm passes over. Some new things because of COVID-19 when it comes to hurricanes is, we are very concerned about the spread of COVID-19 in our public congregate shelters. And again, we only recommend the shelters for those that are being evacuated, and for those that do not have the means to seek shelter on their own by staying in a hotel or staying with friends or family members outside of the evacuation zone. So those that don't have those means, we will always open public shelters. And in those public shelters, we typically allocate, we're just using average rough numbers here, 20 square feet per evacuee. But to increase social distancing and to limit the spread of COVID-19 or the potential spread of COVID-19 in the shelter, we're increasing the space per evacuee to 60 square feet, which is actually the number we already use in the special needs shelters, which is made for those people that receive ongoing daily medical care. So that 60 square feet will also have personal protective equipment available in the shelters for the volunteers, the staff, and the evacuees that cannot bring their own personal protective equipment, such as masks, to again further help limit the spread. Those that have stayed in our shelters in the past know that we let people freely walk around. We'll have to be a little bit more restrictive to reduce contact and reduce the number of high-touch surfaces. But we have all of those things worked out with the school board and the volunteers that will be staffing those shelters. So I'd like to have people rest assured that if you are required to evacuate, that we are doing everything possible to help protect you from COVID-19 at the same time as making sure that you can be protected from the storm. Again, if your evacuation zone is ordered to evacuate. And we do ask that those who are not in those areas or structures told to evacuate, that you do shelter in place at home. And if you live alone, you're not comfortable staying home, then staying with a friend or a family member, or booking a hotel room inland. Those are all great options as long as you have the means and ability to do so. So thank you very much. Oh, one last thing, Mayor, if you don't mind.
Yes,
is
please
this
do.
week is the hurricane sales tax or the disaster sales tax holiday. So as you build your disaster supplies and your disaster kits or restock them for the year, now is a great time to save 7 cents on the dollar here in our community. And without a doubt, if you're shopping for those supplies, please do it here locally. Please visit our stores within Flagler County, within Palm Coast, and help our businesses, whether it's a large business or a small business. Either way, they employ residents in our community, and buying your supplies from those businesses helps our community. So thank you very much.
Thank you very much. Thank you for all your continued effort. And now I'm going to ask Captain Asconi to provide an update, but I want to explain sort of the relationship because this is important to understand. City of Palm Coast has its own fire department that actually was created and started even before the city truly existed as a city and incorporated in 1999. And so Captain Asconi was appointed as the liaison by our fire chief, Chief Jerry Forte, in an effort to coordinate with Jonathan and his team throughout the COVID-19 response. So he has been an integral part from the city's perspective, driving that from a decision-making process and then bringing that information back to our city manager and our chief in an effort to make decisions as we go along. And I think it's important to note when we talk about reopening strategies, the governor had ordered an executive order. I don't remember the date. It was in March, ordered a state of emergency, but also really effectively shut the non-essential businesses down. The governor determined what those non-essential businesses were and had clarified that, and we locally, city, county, all municipalities, all 5 municipalities, although Marineland doesn't really have businesses within their jurisdiction that were deemed that, we complied with the governor's orders. We also complied with looking at our recreational amenities and facilities, and had a lot of discussion with our health department, who is also part of this decision-making team, driving it as a public health crisis, frankly, that we had to adhere to. And so when the governor then allowed his order to expire in the interim, he had formed a task force with several different stakeholders from around the state that provided him input on a reopening strategy. And in doing so, he phased out that approach. And we were, once again, complying with that approach locally as far as the businesses go. And I want to make it very clear, because we do get questions or comments often about churches, and churches were not within the order to ever close, nor were they in the order to reopen. That was a decision that each individual church had made on their own, that they had also come to us and asked for a reopening strategy that could be done safely, and we assisted with that. And then I know restaurants and gyms and those sorts of things fell into different phases that the governor felt appropriate. And there are still a few remaining, very few remaining businesses that are left that hopefully will get some clarification and answers of perhaps why or what the thought process is, because I'm not privy to those conversations. I know you're on calls every day. Bob, I know you're on calls every day. Everyone is certainly on calls every day. But as far as the city of Palm Coast goes, I do think it's important that we clearly define our roles. And Captain Asconi has, again, in Flagler County, we have 5 cities. And so each city is made up of a different demographic, a different age group, a different set of population. And so we base our decisions based on the best information that we have coming at us. And we did make decisions about certain amenities that we felt were appropriate, but it truly was guided by a process. So I think it's important to note that your background really has given you the foundation in which to help guide us from the first responder perspective, safety perspective, and that we've never veered course from. So I just thought it was appropriate, since you're here for the first time, to have our residents understand really what your role is in this moment. I mean, your role is every day a first responder that's responding to scenes and calls and things that are happening throughout the city. But we do have 90,000 residents that still have called our fire department to respond to calls. That has not stopped. It's not slowed down, even through COVID. And so you also are part of a team that has run the day-to-day fire services within the city. So thank you for that, and thank you for your service to our community. But I wanted to do the proper introduction.
Yes, ma'am. Thank you very much for having me, Mayor. Yes, I've been trained in emergency management through FEMA. Chief Forte gave me the opportunity to go and receive that education. And on returning here, I've been able to work with Jonathan Lord and his team. For the last 3 months, I feel like I've been a part-time employee for his team. We have daily phone calls, lots of meetings. They've been very gracious to opening up the door to us. The important thing for our community is that we have somebody in emergency management locally, that we can work with the county emergency management team, that we know the ins and outs of our city, our government, our citizens, that we can share that information and try to find the best practices to place for the health and safety of our citizens. This COVID-19 has been extremely different than everything that we would study traditionally. And we are following the guidance of the national framework. We are following the guidance of the governor and his team, and we're taking those best practices and we're employing them here for our citizens and for our staff. So the governor had moved us in May 4th to phase 1, and his approach was a small, step-by-step, very symptomatic approach of reopening the state of Florida. And if we remember, we reopened the state of Florida in 2 phases. South Florida was not initially opened up in phase 1. They were a few weeks behind. Their numbers were a lot greater than ours were in Northeast Florida. So for them to get a hold of those numbers, the hospital bed availability, it was better to keep them in phase 0 at that time. So now the entire state has been moved into phase 1, and we've been in phase 1 for 1 month tomorrow, which is nice. And we are still seeing everything trend downward. Hospital bed availability is still available. We're not seeing a large surge of COVID-type calls in the hospital. However, I will say that our responders are still responding to a lot of flu-like symptom calls and a lot of COVID-like calls. Dr. Fauci has repeatedly stated that we will see a resurgence in the fall of COVID-like symptoms. And just recently, he's stating that we may see it sooner than the fall. If we are not doing the right things, social distancing, if we're not wearing masks, and we're gathering groups greater than 10, we may see a resurgence a lot sooner rather than later. So it's very important for every one of us to do the thing that's best for our community. Wear our masks when we're out in public, practice social distancing, try to stay within right now we're in social distancing of groups of 10 or less because we are still in phase 1. And those are the things that are keeping our numbers low. And we are doing the right thing in our community. And we are having data that is showing that we are doing the right things in that community. And the time that we stop doing that, we're going to see numbers increase. COVID has not gone away. It is still in our community. We are just doing the things to keep it at bay.
Thank you. Well said. And so, Matt, I'm just going to ask you before, again, we open up to questions because, again, we have also taken a very methodical approach with the reopening strategies within city government, meaning our amenities. And so that phased approach had been our trails and our open space parks first and foremost. I believe that went then to our golf course and our tennis
Yes.
and pickleball with certain rules and restrictions that applied to how Captain Asconi explained it, keeping people safe while recreating outdoors and ensuring their safety. And then we've recently moved into an additional phase of reopening. And I know some of the amenities questions will come up in a bit, but if you can speak to and announce the most recent one that'll be happening this weekend, I think it would be helpful to understand what's happening, what approach your team took, and in coordination, frankly, with the county. So I know, Jonathan, you've been part of this conversation as well as Bob Snyder. So this is not one singular individual or entity making these decisions. It's one of a very strong team approach based on the data that we're seeing. And so I think it's helpful to talk about that, Matt.
Absolutely, thank you. So, correct, this has been methodical and it's been phased, again, using the best information and coordination and collaboration with all of our stakeholders. So this weekend, which is beginning Saturday, June 6th, the parks will be open with the exception of pavilions or places where, again, people would gather, and places that, frankly, we're not prepared yet to have implementing our new cleaning, sanitation, and other routines. These are all, strategic openings. But parks will be open. You can go out and play catch, hit a ball, enjoy the park. Specifically, among that, the big one that will be opening is Indian Trail Sports Complex. And this will be open to team sports, following the directive and the guidance of the governors. I believe it was called the Let Kids Play portion or initiative. But again, done strategically in cooperation, and that includes the group. So very much as we've come to be accustomed to, whether we go out to the Little League fields here, whether we go to a Major League Baseball game, there's certain things we take for granted that have been put in place over the years to protect in a reasonable manner. No, we're not overreacting. I don't want people to understand that, but in a reasonable manner, protects life and safety. So we take for granted the nets behind home plate for those errant foul balls that come at you 100 miles an hour. We take for granted that batters have batters helmets. And there's a reason they don't allow hardcore bats in baseball and different things. And that applies now. We sort of take that next evolution and we apply that to how do we reopen safely, practically, and do our best job as a municipal government charged with the health, safety, and welfare of our citizens and providing excellent amenities and partnering with those leagues to do that. So, I'm going to point out Palm Coast Little League just because it was such an exceptional effort. They went to first the CDC. They went to any national guidance they could find. They worked, I know, with the health department, with the city, with the county. They went to their professional association, which for them was one of the national Little League associations. And from that, they crafted a plan, again, mindful of how do we open, how do we respect the best guidance we have, how do we maintain those essential, again, very, as you said, Captain Asconi, those most basic but fundamental things we know work. How do we distance players or the observers that are going to come to games when all the family or the grandparents want to come watch, the kids or the grandkids play? And so they took a very comprehensive approach that is responsible on their end, allows us, just as importantly, to know that we can facilitate their opening, that we can provide the requisite resources we need to as a city to partner with the various groups to make sure that they have a safe, consistent, and enjoyable experience. And so we've received 3 plans to date that have been vetted through, again, all of our stakeholders, and very pleased that Palm Coast Little League, Royal Palms Soccer, and PAL Soccer had their plans submitted, allowed us to cooperate, and it was a very iterative, cooperative process to review those plans with those partners, and they truly are partners, to come to the best, again, agreement, not just for them to get back to their activities, but to make sure that we could support their needs. Again, the things we take for granted on a normal year of lawn mowing and bathroom maintenance and trash cleanup and all these things that have now been modified. They helped meet us in understanding our resource challenges, and so how we could, again, do this to where it's sustainable, it's healthy, it's appropriate, and then we can continue, Mayor, as you mentioned, to build off these openings with a strategy that starts adding that new normalcy back as we deal with these guidelines and with these rules. So we have also, in coordination, make the announcement. I know it's out. I know the school district put it out. But again, looking at the guidance we have, the phased approach, the Let Kids Play, the City of Palm Coast, Flagler County, and the Flagler County School District have announced the intention to resume in-person camps beginning June 15th. And so there's been a large effort leading up to that to make sure we're still under the groups of 10 or less, pick-up and drop-off plans, safety, sanitation. And so again, we continue to methodically move our way forward, working with all of our stakeholders, the best available data we have to get back to business.
Thank you. And yes, so, it's interesting. I was speaking to Representative Paul Renner the other day. We were just catching up on a lot of different things, and he was asking about the reopening strategies, and he was very appreciative of the approach that the county and the cities and the health department have come together to take. And he had mentioned, when I was saying, we're getting ready to reopen our sport activity play, and I said, my biggest concern is I remember growing up and looking on the sidelines, and your grandparents were there, and you think about the at-risk population and what that means, and so I'm appreciative of the approach they've taken because, and Paul said that, he goes, how do you tell grandma and grandpa to stay home? It's hard, right? So we talk about those issues as sort of the new normal, and this is going to take some time as we go through it, but if we all do this collectively, we will see a positive impact and continue to see a positive impact as we've seen thus far. And there will still be, so I think we're down really when you think about openings or closings. I know there are short-term rentals. The county submitted the plan to the governor's office, and that got approved, and there's some requirements and restrictions and guidelines with that as well. And so I would ask, our residents and those that are part of that team play or part of organizations to contact us or to, sit down and ask about what the plans are, understand, the direction and why, and I think you'd find it very helpful because it's definitely not to take away from anyone. It's really to add value long-term to so many. And so we always are mindful of that. And Bob, you've been part of this sort of reopening strategy from the municipality and county perspective of, again, going towards the recreational side of it. The businesses, we have sent letters of support for certain businesses that still remain closed. We have asked for certain clarification on businesses of why they're put into a certain portion of what phase and how that makes sense. And I know you've been helpful in that regard as well. So how are you feeling as far as the pace and effort in which the governing bodies here have really taken this approach as far as the outdoor activities, recreation, the playground equipment comes up often, and that's a question of, sanitation and cleaning and making sure we're prepared with restroom and resources and those sorts of things. But, you know, it really was under the intention of understanding the health and the spread.
Right. You know, it's a great question, this issue of indoor activities versus outdoor activities. And Dr. Bickle, I'm going to have you chime in here in just a second, but you and I have talked about this a lot. And there is more of a risk, you know, with indoor stuff, right? When we're passing by someone who might be talking or accidentally coughing, sneezing, you know, whether it's a grocery store, the pharmacy, retail store. That's why we are so focused and so strongly recommending the mask wearing. But outdoors, I mean, it's not like there's no threat, it's zero, but it's a less of a threat. It's a minimal threat because you are outside. It is easier to practice distancing when we're outside. And, you know, as a health department, we preach and promote healthy living. And healthy living includes exercise and mobility and movement and moving around. So, you know, it's just supportive to be doing that outside rather than indoors in this current environment. So that's why we've always stressed that. Steve, can you comment on the outdoor-indoor situation and where mask wearing plays in? Dr. Bickle, are you with us?
He shows up as muted on the line.
Oh, wait, hold on.
We hear you.
You can hear me all right?
Yes.
Okay, so what we're trying to do as we go forward is make things simple, people can understand. So we might overly simplify something just to make it understandable. And basically, there's so little evidence of outdoor transmission. It's clearly theoretically possible. In large crowds, it's probably does happen. I mean, they've linked some of the horrible spread in Italy to a big soccer tournament. And so that definitely happens, large groups especially. But for all intents and purposes, outdoors is just a lot safer for a variety of reasons. Mostly just the droplets dissipate more quickly. It's easier just to be socially distanced. So the things that we're kind of emphasizing are make activities outdoors as much as possible, from business activities to social activities to exercise. Wear masks indoors whenever you're going to be around other people. And then, from our side, testing. But we're trying to just make it simple. Now, does that mean that there's no risk outdoors? No, it doesn't mean that. But it's hard to quantify it. But it means it's very much lower risk.
Thank you for that. All right, so now we're going to open up to the questions, and we've covered some of them, but I think I'm going to talk a little bit about the reopening, and then we'll go to some testing, and then masks are there's a lot of questions around, government facilities, so I'm going to ask Jonathan to chime in at one point, Bob, and then also Captain Asconi as well from that perspective. One of the questions that I've received, and I've had conversations, and I did mention it to Representative Renner in our conversations on a couple of occasions, is about when are you going to encourage the governor to allow AMVETS, VFWs, and American Legions to open? These are members-only places. And we've done that. Not only did I have the conversation with Representative Renner, who was going to get some clarification on, what the governor's thought process was with those particular types of businesses and how they differed from a restaurant, frankly, and Paul and I were in agreement on getting clarification about that and understand the timeline of the governor's recommendation and sending
Mayor,
letters
Mayor?
of.
Actually, I have breaking news on that exact topic. That is,
I like it.
my other eye is on another screen that I'm looking at. So the governor currently, as we are doing this, is talking about phase 2 reopening starting Friday.
Wow.
And on the screen that I see, I can't hear, but I can see the bullets on the screen. He is mentioning reopening of bars with 50% occupancy.
Well, then you've heard it right here live. And so
Breaking news.
the letter that I just sent him maybe made a difference. But thank you for that, Jonathan. I know that we have been anticipating that and really trying to push that and get clarification, because that has been an area that I know the mayors have really, thought through, because it didn't register with us about restaurants to this. And so we know our residents, we know that they've heeded the advice, we know that they're taking it seriously, and so that is great news. And so for all the listeners on there right now, we can share with you the most up-to-date information, and that's why we do these, from our County Emergency Management Director, in regards to the Phase 2 approach of the governor, and in particular, when we talk about AMVETS, VFWs, American Legions, those have been lumped in with what are deemed bars, and those are the ones that have been the focus locally of a lot of conversations. So that is an update. Thank you for that, Jonathan. And so I think what we'll do then is we will move to a couple different areas of testing, and then we will talk a little bit more about the reopening. So Bob, I'm going to have you sort of take the testing questions, and if you can either walk through them or pose them to either you or Dr. Bickle or any of our panelists that you think would be helpful.
That'd be great. There's a wonderful testing question here. I got to read it because it's a great suggestion. With more tests available, is there any plan to start being proactive by doing sampling testing of our community? What I mean by sampling testing is to identify a statistically significant sample size for our community and then pick addresses at random from different neighborhoods or areas and test at those addresses to see if we have pockets of asymptomatic people. That is an excellent question, and Dr. Bickle, I know you and I have discussed this many times. We would love to get to that place someday. You know, the issue early on with testing was the availability of supplies and PPE and reagents and other things, and those issues that were problematic have since been addressed. We're getting quick turnaround times from the Quest Lab, who is doing the testing that Jonathan, Emergency Management, and other community partners are coordinating out at the Daytona State College site. And of course, we're doing testing at the urgent care centers and at our health department, doing about 15 to 20 a day there. So the supply issue is not as significant as it once was. And, as we want to keep the testing going throughout the month of June, and I think that doing a random sampling of testing in certain places and pockets in our community would be really applicable to maybe a point-of-care antigen testing, which we are hearing about as a health department. Two departments of health, one in the Duval County and Polk County, they've been the pilot sites for an antigen point-of-care test kit, which provides results within 15 to 20 minutes. So this is our future. So we see something like this happening per this individual's question. Steve, did you want to comment further about that?
Yeah, sure. The thing with testing in general is that it has to be very strategic. And so if, this person who wrote this question obviously knows about testing, knows about sampling, but still the issue is we currently have about 200 cases in Flagler County total?
91, right.
Okay, so that is 0.2% of the population. And if you're looking at, and now there are people who say, well, most municipalities would have 10 times that number of actual cases that have just been underdiagnosed. So that still only gets you to 2,000, and that's a pretty liberal multiplier. And that's not at any one time. That would be like if you have it and have virus in your system for 10 days, That means in the last 100 days, 1/10 of it. So you'd be back to 0.2%, which is 2 out of 1,000. So if you do a sample, no matter any kind of sample, whether it's a good one or bad one in the community, there are going to be so few cases you're going to pick up that it's almost just noise. So in that particular case, I don't think that useful. Now, you take a high-risk group, like a nursing home where there's an outbreak, or a neighborhood, or some reason, a whole bunch of people went to a gathering or something. You might very well just test everybody because there's a lot of people there who will be asymptomatic or pre-symptomatic. It has some strategic uses. And the other area where sampling might come in is like, if we got to, and we're nowhere near this right now, if we got to 10 or 15 or 20% of the population who have had this in the last 3 months, 6 months, 12 months, then these antibody tests, which have some false positives, would be more useful because the accuracy would be better. When the rates are really low, the tests have to be almost perfect to get useful info. So we're looking at that, and we're looking at other ways of monitoring this stuff. But the bottom line is it has to be extremely strategic. You almost have to have a question going in that you're posing that this will give you some data that'll be useful for it. Just to sort of do it randomly or sort of just kind of for surveillance doesn't give you as much info as you might think.
So, I mean, that brings up another good point as part of the testing questions. How will the health experts contain the spread of the virus to isolated pockets? What effective practices prevent the virus from spreading? So I think that speaks to sort of the strategy if both of you want to tackle that question.
Yeah, it's the same strategies that we've been following now for 3 months. It's the social distancing, it's the hand hygiene, staying away from large groups of more than 10, the facial coverings, and again, not just a mask, it could be a bandana, a scarf, anything. I mean, that is what we are preaching, and especially if you are, symptomatic of any way, shape, or form, please, there's no excuse to not get a test out at our Daytona State Community College site or at the health department, because we've really pretty much loosened up completely on any of our testing criteria. You feel like you're high risk, you feel like you've been exposed, or you have any of the 9 symptoms, really, there's no excuse not to get tested, and we encourage you to do so. That is important because you want to be self-isolated, quarantined, and also we want to make sure that your close contacts have been connected with.
Yeah, so I'm going to read a few of these because I think, when we talk about the containment aspect, and if indeed, there were a spike to happen, I'm very appreciative of the work going into our nursing homes,
Yes.
because I think having that done and tested everyone, that really will help as far as that population in those homes that are sort of grouped in. And so, as we go through this reopening strategy, I know a lot of the businesses that are going to be allowed or allowing their employees to go back into the offices, those sorts of things, for the first time, in a few months. So what are some of the strategies you're encouraging for different companies that are allowing their employees to go back in? I'm going to ask Matt a little bit about the strategies of the sort of the City Hall concept. And then I definitely want to touch on the mask aspect towards the end, and then a couple more questions of reopening.
Yeah, so I'll just take the health department, for example. We have been doing core public health services since this crisis began. So we immediately began to wear masks at work. We constantly post signage about hand washing, have hand sanitizer everywhere. We've encouraged some people to work from home. We've practiced telehealth services. So Dr. Bickle, who runs our HIV clinic, he's been seeing patients via Skype and virtually. as many doctors' offices have, and then people who can work at home, gosh, their productivity has actually increased and improved, and we're staying on top of things. So I think those are the practices that businesses can keep in mind.
Yeah, and so Matt, and again, working in conjunction, I know you've done a lot of morning conversations about different departments and things like that. How do you view sort of the reopening strategy of city departments and coming back in City Hall?
Absolutely. So we'd been planning and we didn't know, and now we have this announcement. We'll have to look after the meeting about phase 2, but we had assumed it would be somewhere around July 1, and so we'd sort of use that as a benchmark as our date to be planning. To answer that question specifically, when we reopen facilities to the public, we're going to begin bringing employees back in phases. Again, we talked about that resource allocation. It was a lot to get people out remotely. It's going to be a lot to get people back in and get our system set back up. There'll be some changes at City Hall. We have some stickers on the floors for distancing. We're going to ask people to continue to distance and follow those best practices. We will have a temperature scan station as you come in. We will be taking temperatures, as that is also a recommended best practice for public gathering places. And we will be requiring masks to re-enter the facilities. They're all consistent measures that I know the county as well and other municipalities are taking. Again, best practices to protect the employee, the workforce that we need to continue to preserve, and to respect our residents and have our residents do that with each other. So as we begin, and now I'm sure those talks will, by next week, we'll probably have a lot more information after we dissect today's announcement from the governor and his reopening task force. But masks, temperature checks, for public meetings and for general business, we're going to continue. It's been such a phenomenal success. Truly, I hear it. I just had a gentleman, actually, ironically, he came to drop off a letter of thank you, and I said, you can do that online as well. He's been using our remote services, and so we're going to continue to encourage people, do business virtually if you'd like. We have very robust, very complete services in building and finance and utility payments. And you can access the city through our virtual town hall and through Palm Coast Connect. But there will be, again, some pragmatic and practical changes. Let Captain Moscone talk about them. Again, shooting for this July 1, I think today is a safe date to go ahead and say that we are planning for that reopening.
Yes, sir, thank you. So daily our conversations are, how do we reopen safely for our community and for our staff? We need to put things in place, and that's what we've been working on. What are those safe barriers that we could put up through City Hall, such as the plexiglass, the stickers on the floors? But we've been able to systematically reopen smaller things that the parks, things that people can go out for recreation. So now as we move into phase 2, we start looking at the governor's plan. Is he going to go step by step like he did phase 1 and break it down into 2 different steps? And after this meeting, I'll go in and review what he released. So phase 2 does open a lot of things. It allows us to have more people. It goes from 10 people to 50 people. Is he going to allow the 50, or is he going to go step by step, slow and smart, methodical, and go 25 people? And those are the things that we're going to need to look at and see specifically what the governor releases so we could follow suit. Just because we're in phase 2 does not mean it's necessarily a full phase 2. We went 2 weeks before we went into a full phase 1. So those are things that we're going to monitor on a citywide basis and with partners in Flagler County, and strategically reopen our buildings following that guidance.
Jonathan, did you have anything to add in regards to, again, I know that the county, I've watched some of the county meetings on discussions. The county also has constitutional officers, so they have the clerk of court that runs the judicial center. They have the supervisor of elections that obviously runs elections. The tax collector does a lot of, DMV services, taxes, those sorts of things. And the property appraiser, I know, is redoing their offices, but having a reopening strategy as well. Jonathan, can you speak to, are you aware of the constitutional officers? And then we have the sheriff's department as well. So those are the 5 constitutional offices in Flagler County that are under the umbrella of the county, or they're independent of each other. However, a lot of those are housed, including the school district offices, are over at the Government Services Building on State Road 100. Can you speak to that, Jonathan?
Yeah, so all those constitutional officers plus the school district I sometimes lump in as a constitutional officer is the fact that they're all housed in county provided facilities, and the county provides some of the standards in there. So we've worked closely with all of the county departments within the county facilities, as well as all of those constitutional officers and school district, to kind of all be on the same page and what we need to do to protect the employees and residents visiting the county-owned facilities. And one of the big things we've done since we started the phase 1 reopening is we've installed a lot of plexiglass barriers at customer service counters that weren't there before. We spent quite a bit of time and effort doing that. Our general services department worked very, very hard to do that. Well, I don't think they're 100% done yet, but they're pretty close to being done. And we're doing full screening of all employees as well as visitors as they enter the facilities with temperatures and requiring them to wear face masks. So what the big changes that phase 2 will equate to will be is we will start letting people back, the general public, back into the building, as well as, but continue those screenings, because we've been doing only appointment-based services, really, very limited services to the public out of those buildings. So you'll see that change now that we know we're in phase 2 over the next week or two. Some of it will take a little bit of time for us to do. I know the public's itching for just a button to be pushed and everything goes back to normal, but as you all heard our public health folks say, unfortunately, we can't. COVID hasn't gone away. Its growth rate has slowed significantly, which is a beautiful thing. It's a wonderful thing, but we want to keep it that way. So we don't want to be that county, that community in the news that has a big growth spurt of COVID-19. So, but at the same token, we don't want to keep our community locked down either unnecessarily. So it's about walking that fine line and having different steps within the phases or tasks within the phases to make sure that we can provide all the services that our residents expect out of their governments. At the same time, do it in a way that also protects the residents and the workers that interact with those residents.
That's great, thank you. I'm going to ask one specific question about, because I think it's important, they mentioned senior citizens, and then I'm going to mention, I do know there's a couple constitutional officers, one in particular that's announced, requirement of masks as well. But there are about 40 of us pinochle players who are wondering when we're going to be able to use the room at our community center again. And, I do think it's important that, unfortunately, this virus really has, attacked the elderly population, the most at risk, if you will, in our community. And Palm Coast falls into a large population of that at-risk population. So, they have been locked in their homes. They have been with many of our other residents, but we are mindful of that. So I think as part of when we do talk about the reopening, and we do know that COVID is still very much an issue, we want to be mindful of that population. If there had been any discussion around, we have, by the way, at our community center, we have to give a big shout out to our Parks and Rec team, because I can't remember how many programs that they offer at the community center. It's extraordinary. I mean, it's
over 300.
It's over 300 programs itself. So the programs, a lot of them are diverse with different age groups, but in particular, can you speak to sort of the senior programming?
And moving forward,
Yeah.
absolutely. So to your point, and I was kind of trying to parse out real the high level of the governor's order that just came in an email, and they acknowledge still the most vulnerable population, and you can agree, Bob, I think is the current understanding is 65 and older, which falls squarely on our senior citizen population. Part of the challenge we've had to do is balance the need and the use. Again, up until today, it was groups of 10 indoors. I think that's still appearing to be the guidance. And then when we talk about the wonderful community center, which community centers are for community, we are a multi-generational community. We understand that, and we embrace that. I heard you on a radio message the other day. We are multi-generational. We want to, continue to honor that and respect that. But we're talking about mixing all the age groups, from little kids who can't keep their fingers out of their mouths or out of their noses as we all were little kids to our seniors. And so we've had robust conversations. That was one of the reasons, that was actually the primary reason way back in February, we bought what are called Aeroclave room sterilizers. And we bought 3 of them because the conversation was, how do we respect and protect the senior population? This is a great way when we're ready that, you know, once a day we can run this and disinfect the entire room in an aerosol to do our best job as a community, again, respecting and responding to our residents. So I think we'll have more information, I hate to say it, next week, but we have had very robust discussions about once phase 2 comes, once we assess and understand, again, camps opening on the 15th and this strategy, how now do we fold in yet another diversity of use in a building with limited room space and limited access and cross access to get our pinochle players and our senior Olympics and all of our events that we know are so cherished in this community back online. I would just tell our population, this is not lip service, it is a priority, and we will continue to move again with the Governor's Reopening Task Force and those guidelines and get these activities back as we can.
And so we, unfortunately, you know, have come to the end of our virtual town hall. We always have these robust conversations and time runs out quickly. This is what I would say to our residents, since this is hot off the press as far as the governor's announcement for phase 2. What we try to do in the county, and I know, Jonathan, this is important to you, this is important to Bob, the health department, this is important to Captain Asconi, as part of the response team to COVID, as well as our city managers and county administrator. It's to get an official response out there. So these are important that we do that in a moment. So I would ask our residents to go on any of our official sites and to really wait for what that strategy is going to be. So please continue to be patient as you have thus far and been unbelievably generous and part of the solution, not part of the problem, which we all appreciate sitting up here. It's been an extraordinary effort by our residents, and it has worked. It has worked. And so we are going to be, continuing to ask for the mask wearing. You're going to see a lot of conversation around that within phase 2 with additional reopening strategies. But we're doing it in a way that a lot of conversation and dialogue has to take place in an effort to understand the complexities of what impact that's going to be with that strategy. So, but, we are hopeful, and, we continue to be hopeful as we drive this. So more to come. You can always go on our site, the county site, the health department, for that official response on what that strategy is going to look like. But as you just heard, the governor has made an announcement, so we will be working very aggressively to get some accurate information out to our public on what that can mean to them and the timeline. So this weekend, we will see our fields reopening and everything else and group play. Please stay safe, everyone. Please continue to wear those masks indoors. Please continue to social distance, and we will all get through this together. I thank you so much.